Hi, what's up, guys? Welcome back to another episode on the show Behind the Scenes in Health with Dr. Ron. And if you're new to this channel, this podcast, this station, whatever you want to call it, my name is Ronald and I talk about everything and in between healthcare, health tech, alternative careers, and all of that. So if that's the kind of content you've signed up for, yes, you're in the right place. So don't hesitate to hit the subscribe button down there. Give this video a like, share with your friends and family so that they can enjoy the same content, right? So on today's episode, I'll be talking about the very important thing you need to do before you decide to get into health tech. I usually get this question a lot. What are the things I should do and all of that. So this one I'm going to talk about is the most important thing you really have to do before you decide to get into health tech, and it's called or I like to call it a self-SWOT analysis. So SWOT stands for strengths, opportunities, weakness, and threats, right? So you're doing a self-SWOT analysis about, and I think basically for me it's about understanding your why of getting into health tech, right? I usually say health tech is not for everybody. It's not every doctor or nurse or clinician or pharmacist that is going to get into health tech, right? And or probably enjoy health tech despite the allure or how interesting it sounds, or everybody's making noise on social media, health tech, health tech. There's some people that will get in, a few weeks or months, they get out because they like clinical practice or whatever they were doing before. So it's not for everybody. So before you get in, you need to understand, why am I getting into health tech, right? First of all, is it because of the hype, right? Because probably the bandwagon effect, because everybody is getting on, and this fear of missing out and all of that. Is that why you want to get into health tech? You need to ask yourself that question. This analysis has to be very, very honest. You need to write it down. You need to ask your friends, your families, colleagues for honest feedback, right? So in terms of strengths, you want to look at what professional qualifications or certifications do you have that sort of make you stand out from the rest. Do you have any form of expertise that you think you can leverage on to get ahead? Are there any projects you've completed successfully in the past relating to tech or even the healthcare space, right? You want to look at that. Then in terms of weaknesses, do you have, again, talk about necessary skills and qualification, because sometimes for you to get ahead, you need some degrees or certifications and all of that. Do you have some bad habits, things like poor communication skills, things like procrastination, things like indifferent time reporting, things like coming late to work, because that wouldn't really work if you're in the tech space, right? Then in terms of opportunities, are there new positions you're looking at in your company that have been advertised, or maybe in your hospital or where you work, that you really like? Or maybe you've seen somebody, maybe a mentor that is doing something, it looks very interesting. Or is there any technology or trend that you really think you might want to latch on to? For example, now we're talking about AI, machine learning, chat GPT, and its impact in healthcare and all of that. So you want to look at all of that. Then a couple of traits really, things like maybe personal traits that might be hurting your career achievements, right? Is it your attitude? Is it your personality? Do you get on along with people, or do you quarrel with people, or you find it difficult to work as a team member? So these are questions you need to ask yourself before you now make that plunge, right? So if there are deficiencies you find that you feel, okay, this is something I can work on and I can amend, fine, that's good. But bottom line is, you need to do this analysis to understand why. Because, for example, I'll give you an instance now. Entry level into health tech now, you might not be earning so much really, because you're just starting off, right? So are you going to be patient to wait till you get to the top, or even middle, before you start earning significantly? Because when you now compare to your mates and colleagues, they're earning big money and you're sort of struggling. Are you going to be able to put up with that? So these are some of the questions you want to ask yourself. And another thing I usually tell people to do is look for people who are in these areas, data analysis, data science, health informatics, clinical informatics, digital health, and all of that. Find them, talk to them, ask them what's their day-to-day activities, do they have any regrets getting into this space, and sort of give you an informed decision as to, again, it's good to understand that everybody's story is not the same, or everybody's why or motivation is not the same. But again, you might be able to pull some, maybe common learning or common thread from people's experiences that can help shape your own decision. So yeah, that's it for me for today on today's episode. So don't forget to do the self-SWOT analysis before you decide to plunge into the world of health technology, right? So if you've enjoyed this video, please give it a like, subscribe, and do not leave without sharing this video. I would like to hear from you. If you're in health tech or you're trying to get into health tech, what are you doing? What's that single piece of thing you want to do, or a couple of things you want to do? I'm in the comment section waiting for your responses. And till I come your way next episode, I still remain your host, Dr. Ron. So bye for now.